Welcome back to session 2, and we're going to talk a little bit about counseling modalities, some of the things that I have found to be helpful and some of the things that don't tend to work. I think I mentioned in the last session that usually as trained counselors or ministers, we're coming at things, the books that are written out there that are wonderful for most of our couples in therapy don't seem to work too well with our Aspie-NT couples because most of our counseling modalities are based on neurotypical to neurotypical partner relationships. Now, we've been talking a lot about Aspies tending to be straightforward people, and so I mentioned to you cognitive behavioral therapy. No matter what series or DVDs, blog, or article that you hear me speak about or I've written in, you're going to hear me say cognitive behavioral therapy. What does that mean? Cognitive behavioral is simply looking at our cognition, our thoughts process, and how we form behaviors based on our thought processes. So what this type of therapy, CBT, is the most helpful with people who are more Aspie, who are this logical, the way that they think, and we're looking at efficiency and not so much emotional and emoting. So when I'm looking at this, I'm working with the cognitive behavioral as my theoretical framework, but you also have to do a little bit of family systems work as well, because it is important for them to understand about family systems. We talked about with autism or Asperger's, a person self-references. So it's easy to kind of see yourself in a bubble and not part of a bigger system. So you have to do some explanation of family systems about how this action and the ripples of it affects the system. When you made the decision to spend all of that money on this really expensive golf club, yes, you did that as an independent act, but how did that affect the rest of the family on groceries and mortgage, or how did that decision impact the rest of us? Because a lot of times they're not seeing the greater impact of that decision. It's, if I want this golf club and I have the money for it and I have it right now, what's the big deal? It's not hurting you. This is about something that I wanted and I got, so kind of leave me alone. So we do have to go from that cognitive behavioral approach and putting some in family systems in for the understanding of the greater impact. Dr. Atwood explained at a conference again in Atlanta, these individuals rarely know how they feel most of the time, much less how others feel. They also tend to think that others are thinking like them. Asking them a question about how someone else might feel about something that might happen is completely foreign concept to them. Approaches that are emotionally based are frustrating and painful for Aspies. However, good, solid logic and explanation of consequences of various behaviors and how they affect the spouse and the family helps their 1 + 1 = 2 mentality. Sharing stories or actual events is usually effective. Remember, in children's therapies, social stories are often used to teach children and adolescents new social skills. So sharing with Aspies stories of marital success and marital failure with practical guidelines on how to achieve success and how to avoid failure provide a roadmap to learning new strategies. Most Aspies are very loyal people and they do want to please their spouse. They want to please the one they love, but they feel stuck on how to demonstrate that love in actions and words to the other person.